spent the last 10 years as a rural hospital CEO in 2 different rural Kansas communities and have fallen in love with rural people, and am more convinced than ever that they have a seat at the health equity table. Hospitals are facing formidable challenges amidst this pandemic, with access to personal protective equipment, supplies, resources, finances, and with rural hospitals, it's particularly challenging.
Before the COVID-19 pandemic, rural hospitals in their communities were struggling for survival. What COVID-19 has done is it's essentially taken us into highlighting or putting a spotlight on the fractures that already existed within rural communities in terms of their healthcare delivery.
Nursing is really cool in the regards that you can provide a lot of different services, but rural really connects to my heart because I get to take care of the community that has taken care of me.
This community and the patients we serve are very important to me. They're my friends, they're my family, they're my neighbors, they're the people I see at the grocery store. And I think it's really important for people to remember that rural hospitals play a very essential role in care for these people.
You think, hey, we're in a rural place or we're just isolated or the virus can't come here and affect us like it's affected other places. But if you look at our area a little bit closer, we are surrounded by meatpacking plants. The meatpacking plants can't close. America needs to eat. And with that comes all kinds of things that make social distancing more difficult, not less difficult.
The meatpacking plant is one of our major resources as jobs. And so it's a multicultural community. We have 73 languages. We have Somalian, Hispanics, we have Filipinos. We all come together as a community.
One of the most significant challenges for rural hospitals during COVID is their access to personal protective equipment, or PPE. And rural communities find themselves at the end of the traditional supply line, which generally favors orders of 1.5 million as opposed to 150, right? And a rural community may need 150 masks to keep their staff safe, but those 150 masks they really need.
Lincoln Community Hospital is the only facility within a 75-mile radius. If I can't have PPE and I can't keep my staff and my patients safe, I can't be here and I can't provide that level of care to people within that big of an area.
If we don't have enough PPE, then we are exposed.
Now we're seeing, in the wake of COVID-19, rural populations facing the problem of accessing supplies, such as personal protective equipment, exactly what Heart4Heroes is trying to produce in terms of an outcome.
Heart4Heroes is hacking the supply chain. It is taking the last and making them, if not first, at least in the middle of the line. It is engaging ProjectCURE to procure or locate supplies that can go to rural or underserved communities. It is engaging Angelflight and the networks across the nation of thousands of volunteer pilots who donate their plane and their gas and their time to deliver these shipments of PPE out to the nearest landing strip near these rural hospitals at no charge. And the people that receive them are some of the most appreciative.
We received a donation of PPE. We went out to the airport to pick it up, and actually as we saw the plane land, I'll get teary even talking about it because it was just very tearful, very heartwarming to know that people were donating that to us and that we were able to give that stuff to our nurses. It was a wonderful experience.
I'm so thankful for Heart4Heroes for thinking specifically of rural communities like ours. I don't know how many different ways to say thank you, but we can't say thank you enough for that.
This connection is going to be taking rural providers around the country, presenting the need, and then connecting that with the resources that are out there. And that includes Heart4Heroes, which is the sourcing mechanism, And then Angelflight is another partner that could be useful in getting those supplies from where they are to where they need to be.
This is not a short-term problem, this is a long-term problem. We are going to see PPE shortages for the next 12 to 24 months, really until we have either a vaccine or herd immunity. We're going to see shortages of PPE. And this support is not just needed for a month or two. This is needed for years. And this will determine, in many ways, the outcome of rural healthcare in the United States.